In the era of targeted therapy, really where we're shifting in indolent lymphomas and across the board in hematologic malignancies is trying to combine drugs that have modest activity, well tolerated, that potentially have synergistic activity in preclinical studies. So an example of this is the combination of ibrutinib and venetoclax in follicular lymphoma. So Dr. Ajani presented results from a trial that we participated with here in Hackensack, looking at ibrutinib and venetoclax in patients with relapsed refractory follicular lymphoma. So if you look at the single agent activity of ibrutinib in follicular lymphoma, it's quoted somewhere overall response around 21% with a complete response rate of around 11%. For venetoclax, the overall response in single agent in follicular lymphoma is around 38%, with a complete response rate of around 14%. And particularly with venetoclax, this is surprising because you would think it works in follicular lymphoma. Follicular lymphoma is characterized by this 14-18 translocation. BCL2 is critical, at least pathognomonic for follicular lymphoma in some ways. And the fact that a BCL2 inhibitor has really a modest activity at best is surprising. So since there's been some evidence in preclinical studies that ibrutinib and venetoclax have not only additive but synergistic activity in follicular lymphoma cell lines, there was great enthusiasm to combine them in a study. So this ongoing phase 1/2b study was reported. The efficacy of the entire cohort, at least at this phase, was 69%, with 25% of patients achieving the CR. However, looking at those patients who were dosed at the phase 2 recommended dose level, which is ibrutinib 560 milligrams PO daily and venetoclax 600 milligram PO daily without a ramp up, the overall response rate was actually 83%, with 33% of patients achieving CR, so much higher than we would have anticipated based on the single agent activity. So this highlights the importance of investigating this, increasing number of single agents we have available in the hematologic malignancy state in terms of combination therapies that are well tolerated and may be significantly more effective in combination than what we're seeing as either, single agent activity.